Late complication that we have seen before speaking about all this timing was non-union. Is it clear? And non-union, we said that if the timing of the bone healing is 2 times the normal time, it is said to be non-union. So what do I mean? We said that for the upper limb is completely healed for children in 3 weeks. It means that if the child is already at 7 weeks, he has a fracture of the humerus, he has not yet healed, he is already more than 2 times that normal time, it is said to be non-union. So when you are more than 2 times the normal time of the bone healing of that limb, it is already non-union. So example again, if you have an adult who has a fracture of the femur, is it clear, and then he is already at 26 weeks or half post the fracture, but it has not yet healed, it is said to be a non-union because it is more than 2 times the 12 weeks, which is 24 weeks, more than 24 weeks already. Is it clear? So that is said to be non-union. The second thing is delayed union. Is it clear? You have among the non-union, you have classification of non-union. Inside non-union, you can have atrophic non-union. Atrophic non-union means that when you do an X-ray, you see lucency. Is it clear? So there is nothing inside. There is no hard callus formation. Is it clear? It's just connective tissue. That is atrophic non-union. Then you have also hypertrophic non-union. It means that it is neither hypertrophic nor atrophic. It's just in the middle. And then you have that's called instead eutrophic non-union. It's not hypertrophic. It is eutrophic non-union. You have atrophic non-union. You have eutrophic non-union. Meaning that it is resembling like the bony tissues around, but it is still a non-union. Is it clear? And then you have hypertrophic non-union. Hypertrophic non-union is when you have excessive hard callus formation. Is it clear? That's why it's getting more opaque at that zone. You have hypertrophic non-union, and then the last one you have a septic non-union. So those are all examples of non-union. Are you getting? Now the next point after that we have to evaluate now is delayed union. Delayed union is when the bone healing process is between 1.5 times to 2 times the normal healing process. So if somebody is 1.5 times his normal healing process to 2 times, it is said to be delayed union. But when it is more than 2 times the normal healing process, it's said to be non-union. Now the next complication, that late complication you can have, is malunion. Malunion is when there is an abnormal contact between the bony fragments. Is it clear? When you have an abnormal contact between the bony fragment resulting to a deformity, it's said to be a malunion. The fourth complication that you can have is ankylosis. Is it clear? Ankylosis is another complication. Ankylosis is when generally you have fractures at the level of joints. That is why fractures at the level of the joints is generally said to be an indication for surgery. Because when you have fracture at the level of the joint, it can easily result to ankylosis or a stiff joint. So ankylosis is called a stiff joint. Is it clear? So when you have that, it can result to that. The fifth after ankylosis, you have also arthrodesis. Is it clear? Arthrodesis. Arthrodesis particularly is called a locked joint, and this arthrodesis particularly occur when you have a avascular necrosis of a femoral head. Is it clear? And that avascular necrosis of femoral head occurs when you have a femoral neck fracture. And it occurs when you have a femoral neck fracture. Why? Because it has a retrograde circulation, meaning that the femoral artery goes down. Is it clear? It has crossed the femoral head and femoral neck, and then it later on gives a branch called the medial circumflex artery to the femoral head. Is it clear? The medial circumflex artery to the femur, and that medial circumflex artery now goes back up. So when there's a fracture at the level of the distal part, it is also going to result to an injury to the medial circumflex artery that normally supplies the femoral head. Is it clear? So that's why you are going to have an avascular necrosis of femoral head in the case of adults who have a fracture of the femoral neck. But now in children who have fracture of femoral neck, they may not have avascular necrosis. Why? Because there is also supply from the round ligament above. Is it clear? So you have children have also a supply from the round ligament above. Normally the femoral vein that comes is supposed to give the circumflex artery that goes back up. Is it clear? But children have the supply, 80% supply from this round ligament above, and only 20% supply from this major circumference. So that's when there's lesion there, it's going to have compensation at the level of the fovea centralis supply. Is it clear? But in adults, you have instead 80% here and only 20% here. So more when there's lesion here, only 20% supply is going to result to a vascular necrosis of the femoral head. Now, the next one after that, we have spoken about all the late complication. Now we are going to move to your diagnosis.